This is adenomyosis. It occurs when the tissue that normally lines your womb, so endometrial tissue, which is like glandular-like tissue, grows into the muscular wall of the womb or your uterus. Now, this tissue continues to act in the same way as the lining of your womb does. It thickens, causes inflammation, breaks down, and then bleeds during your period. This can lead to heavy, painful periods and an enlarged uterus in some women. You may experience pain at other times of your periods too. So in some women, with the enlargement of the uterus, it means it can press on other pelvic structures, such as your bladder. So you might find it irritable and you might want to go to the toilet a lot. Your bowels as well. So you can get pain around the back passage, pain during sex. And it's sometimes, adenomyosis is termed the evil twin of endometriosis, because these two conditions can come together. Essentially, it's tissue from the womb lining being found in the wrong place. It's more complex than that. The diagnosis is made by listening to the history, listening to women and believing women. Transvaginal ultrasound scan can be done, a CT or an MRI can help make the diagnosis. A blood test checking for anemia, because if you're having heavy painful periods, you can become anemic. Currently, as it stands, we only have management options such as painkillers, the hormonal birth control, the Mirena coil, because as it stands, the only cure is a hysterectomy. But all that depends on where you are on your fertility journey, and a hysterectomy might not be the option for you. Sometimes we pick up adenomyosis in perimenopause. During the perimenopause, there are other often significant fluctuations in your hormone levels. Now, each person will have their own unique experience of perimenopause. This is when you will get probably some menopausal symptoms such as hot flushes, night sweats, mood anxiety, mood changes, disturbance to your sleep, muscle pains, and changes to your periods. Now, it's these hormonal changes that can make your periods unpredictable. And that's why it'd be useful to do an ultrasound scan in a woman that is complaining of heavy, painful periods, and she might be perimenopausal, so anyone over the age of 40. It can mean that your periods become less frequent, but you bleed for longer. It is safe to have topical vaginal estrogen for the prevention and management of genitourinary syndrome of the menopause or vaginal atrophy. It is also safe to consider systemic hormone replacement therapy in the management of your heavy periods and your menopausal symptoms, and you need to have a discussion with the doctor if you have a history of adenomyosis. So it's really important that you speak to a GP, take your symptom list with you, and also discuss all the options that might be available. It doesn't mean that because you have adenomyosis, you cannot have systemic hormone replacement therapy.